Hello, everyone, and welcome. My name is Joyce Resin, and I'll be your host for this afternoon's live virtual town hall on the BC election. And I'm here with candidates Anne Kung with the NDP, Mary Pollock with the Liberal Party, and we were expecting Bill Massey from the Green Party. Unfortunately, he was unable to attend at the last minute, and he sends his regrets. However, we're very fortunate because we have a replacement and a wonderful replacement. I'm going to introduce you a little bit later to Annemieke Holthaus, who has kindly agreed to step in at the last minute, and she is from Victoria Swan Lake. I'm joining you today from Vancouver, British Columbia, and I'd like to begin by acknowledging the land from which I'm joining you. It's the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I thank them for having cared for this land. Of course, we're meeting virtually today from many locations across BC and Canada, and I want to encourage each of you to take a moment to acknowledge the land from which you're joining today's webinar and to reflect on how we can each move forward in reconciliation and collaboration. I want to thank all of you for joining us today, especially the provincial parties and the candidates who are here. This webinar is intended to help us understand where the three provincial parties in BC stand on issues of great importance to us as seniors, and therefore to help us make a decision when we cast our votes on October the 24th. So now it's my privilege to introduce you to the candidates. In alphabetical order with us today, Anne Kung with the NDP. She was elected as the MLA for Burnaby Deer Lake in 2017, and she is the Minister of Citizen Services. She was also the Parliamentary Secretary for Seniors. Before becoming an MLA, she was a three-term Burnaby City Councillor. Ms. Kung immigrated to British Columbia as a child and has lived in Burnaby for over 30 years. She completed her post-secondary education in music and education at UBC. Before being elected MLA of Burnaby Deer Lake, Ms. Kung was a music teacher in the Burnaby school system. Anne Kung lives and works in Burnaby. Welcome to Ms. Kung. Now I'd like to introduce you to Annemieke Holthaus, who is the candidate for Victoria Swan Lake. My passion for justice, human rights, and democracy started early and led me to become a human rights and international law lawyer. For 30 years, I worked as a legal advisor to the Government of Canada on human rights issues and criminal law reform. I represented Canada internationally, negotiating treaties and participating in Commonwealth and G7 meetings. Welcome to Annemieke. Mary Pollock is with the Liberal Party and has represented Langley constituents since 2005. Ms. Pollock currently serves as Opposition House Leader. And during her political career, Ms. Pollock has served on and chaired several committees and has also served as Minister of many departments, including Health, Environment, Transportation and Infrastructure, Indigenous Relations and Reconciliation, Child and Family Development, and Healthy Living and Sport. Before being elected to the legislature, Ms. Pollock served as a trustee and chair of the Surrey School Board. Welcome, Ms. Pollock. These provincial candidates are joining us today to speak about their campaign platforms and also to answer your questions and your priorities. This webinar town hall is being hosted by the National Association of Federal Retirees and the Council of Senior Citizens Organizations of BC. So it's now my pleasure to ask Sheila Pither, President of COSCO, BC, and Leslie Gaudette, Advocacy Program Officer with the National Association of Federal Retirees, to make their welcome remarks. Sheila.
Thank you. Thank you. Greetings from COSCO. We're really honored to be here and having this very, I'm sure, interesting an hour and a half together. COSCO is an umbrella organization. We have about 65 different affiliated groups. We are nonpartisan. And our work is for the well-being of seniors in the province and through our connection with the National Federation of Seniors with people across Canada. So welcome to you. And now I think Leslie, please.
Thank you, Sheila. My name is Leslie Gaudet, and I'm with the National Association of Federal Retirees as Advocacy Program Officer for British Columbia. Federal Retirees is the largest national advocacy organization representing 176,000 active and retired members of the Federal Public Service, the Canadian Armed Forces, the Royal Canadian Mounted Police, and retired federally appointed judges, their partners, and survivors. This includes 24,000 members living in all parts of British Columbia, and I give you my warmest welcome to all members and all British Columbians from across the province who have joined today's webinar. Since our beginnings in Victoria in 1963, we federal retirees have advocated to improve the lives of all Canadians in retirement and to protect our members' earned pensions and benefits. Our nonpartisan advocacy work supports secure, healthy, and dignified retirements for federal retirees and for all Canadians. The ability to age in place with dignity and security should not depend on your postal code. Canadians of all ages urgently need all levels of government working together on these priorities to ensure home care is available, medications are affordable, communities are accessible, and retirement incomes are secure. We look forward today to hearing from each of the candidates about these priorities. Thank you.
Thank you, Sheila. Thank you, Leslie. Before we get started now, we have a few Zoom instructions to help you make the most of our town hall. And Joanne Miron from Federal Retirees is going to walk us through them. Joanne.
Thank you, Joyce. So first, note that this webinar is being recorded and we'll email it to everyone who registered for this town hall later next week. So while we shared these screenshots, you'll notice the speaker's video box as well. If the box hides some of the images we're sharing, simply minimize it by clicking the line in the top left corner or move it by dragging it with your mouse elsewhere on your screen. To enter or exit full screen viewing on your device, click the button labeled Enter or Exit Full Screen at the top right-hand corner of the Zoom window. All attendees are in view mode only, which means you'll only be able to see the presenters. If you would like to ask a question during this webinar, click the Q&A button at the bottom of your screen to open the Q&A window. From the Q&A window, you may type your question in the box and click the Send button to submit your question. Note that all questions that we will answer during the webinar will appear above the question box. We'll be answering questions at the end of our presentation, but please type them in as you think of them. I would also like to point out that you can vote on questions that have been submitted by clicking the thumbs up icon. This will help our team understand what you most want to know about from our candidates today. If you see a question you'd like to have answered, please click the thumbs up icon. The chat option at the bottom of your screen is unavailable, so please be sure to use the Q&A feature to submit your questions. Should you need to leave the webinar at any time, simply click the red Leave button at the bottom right corner. Back to you, Joyce.
Thank you, Joanne. And now let's get started. So for today's webinar town hall, each candidate will be given the opportunity to make opening remarks. We're then going to move into the question and answer portion. And at the end, each candidate will provide closing remarks. We have randomly selected the speaking order for opening remarks, and we'll be rotating through this order as we get into our questions and discussion today. So our speaking order, we'll have Ms. Pollock with the Liberal Party speaking first, followed by Ms. Kang with the NDP, and finally, we'll hear from Ms. Holthouse with the Greens. And you will each have 2 minutes for your opening remarks. So over to you, Ms. Pollock. I'm going to turn things over to you to give us your opening remarks, please.
Thank you. Thanks, and good afternoon, everyone. Very pleased to be here. My name is Mary Polak. I'm running for re-election with the BC Liberals in Langley, and that puts me on the traditional territories of the Katzie and the Kwantlen First Nation. My personal history is what attaches me the most to seniors issues, and that's with my dad. Not unlike many people my age, I'm doing both. Looking after both ends of the spectrum in terms of age. And my dad, I've been with him all through the journey of assisting him when he was bringing in more home supports and living independently. Then for about a year lived with us in our home here. And then more recently, about a year ago, he moved into an assisted living / independent living residence. Now, what do you learn from all of that? A big part of what you learn is the importance of making sure that dad can be independent, still experience independence in all those stages. I've had ministerial responsibilities related to this. Back a number of years ago, I had responsibility for public health, including looking after the standards portion of what was occurring in long-term and assisted living residences. And I'm proud of the fact that we not only instituted some, I think, better standards, we can always do better, but we were the first to put in place full audits that then would release the data publicly so that there was greater accountability. And that's caused governments ever since then to have to wake up when there's something going sideways. Also very proud, of course, of the seniors advocate and having instituted that role, and really, I think she's just done a tremendous job. And again, another thing to be proud of. As we go forward, we're looking at some immediate things we can do. One of them is a $7,000 credit for home support services. It's modeled on what they've done in Quebec, which appears to have worked very well. Also, $1 billion to immediately replace and upgrade long-term care and assisted living. And for senior drivers, and I've heard from them on this for years and years, we would waive the $200 exam fee for senior drivers. So we have to acknowledge the challenges that are on the horizon. We need to create that support structure that maintains independence and choice for seniors the best possible care.
Thank you very much. Appreciate those comments. And now I want to welcome Ms. Kang for her opening remarks. And please remember, it's 2 minutes. Ms. Kang.
Thank you. Hi, everyone. My name is Ann Kang, and I am on the traditional territories of the Coast Salish First Nations on the Squamish, Musqueam, and Tsleil-Waututh. I am very blessed to be an immigrant to BC and to Canada. I was elected to the legislature in 2017 for the riding of Burnaby-Deer Lake. And in the 3.5 years that I've had the privilege of serving in various roles, in 2017, I was appointed the Parliamentary Secretary for Seniors, and that perhaps is where I met most of you. And there my mandate was to improve the lives of seniors in British Columbia. In August 2019, I was appointed as a Parliamentary Secretary for Multiculturalism, where then I began the important work of fighting against hate and racism. And in January of 2020, I had the honor of being appointed to the role of Minister of Citizen Services. And all these roles have kept me really busy, but really on my toes. And I'm out there listening to what citizens need and how we can move forward with changes for the better. When I first took on the role of Parliamentary Secretary for Seniors, senior care had been privatized and were quite underfunded under the 16 years of BC Liberals. And so we're looking forward to improving that with more years to come. And in 2017, when the BC NDP first formed government, 75 of the care homes were underfunded, and they were under 2.9 direct care hours. And from what I'm hearing from seniors, that it was very hard for them. I went to work immediately, and when Ronna Ray Leonard, the BC NDP candidate in Courtney Comox, she took over this position, we brought that number down to less than 7. So even to this day, we continue our work to fix the problems that was left by the previous government. This topic is near and dear to my heart, as I have, oh, my time is up.
Okay.
I'm a 95-year-old grandfather, and I'm going to do my utmost best to treat everyone just like my grandparents and my parents.
Thank you very much. Now I'd like to invite Ms. Holthouse for your opening remarks, please. 2 minutes.
Hi, thank you, Joyce. My name is Annemiek Holthuis. I'm a BC Green candidate for Victoria Swan Lake. I'd also like to acknowledge that I live and work on the traditional territories of the Lekwungen speaking peoples. My background is as a lawyer for the federal government, and I'm a federal retiree as of April 2020. Most importantly for today's discussion, I'm a mother of 4, a daughter, and a senior of the future. I'm running for the BC Greens because I believe we need more voices in the BC legislature that support the core principles of the BC Green Party: social justice, respect for diversity, participatory democracy, and a real commitment to the environment. As we know, BC is facing a COVID-19 pandemic, an opioid crisis, an affordability crisis, and a climate crisis. There's been great collaboration with the parties on the COVID-19 crisis, but a crisis can often bring out the best in people, but it can also expose the cracks in society that have been papered over during normal times. And I think it's fair to say that seniors have borne the brunt of the COVID crisis. BC Greens believe that we need to provide better quality care for seniors, shift to a mix of public, nonprofit, community-based services and co-ops, enhance the accountability for seniors' care, and recognize caregivers as professionals they are with the salaries they deserve. The BC Greens are working towards a just and sustainable future for all British Columbians, including the seniors that have built this province. Thank you, and I look forward to discussing these issues further with you.
Thank you very much, Ms. Holthouse. Thanks all of you for your opening remarks. And we're now going to move into the question and answer portion of the town hall. You've raised so many issues already, but what we'd like to do, of course, is to do a much deeper dive into those issues. I will be asking the questions that the federal retirees and COSCO have prepared, as well as questions submitted by their members for this webinar. And then I'll be taking the questions from the floor, from you, using the Q&A function. So I just want to remind you that at any point, please feel free to go to the Q&A panel at the bottom of the Zoom and type in your question. And if you see a question that you really like and you want to make sure that we know is a priority, please just remember to click the thumbs up icon. So the very first question to all of you is this. There are many issues and areas of pressing concern to seniors in British Columbia. You've alluded to many of them in your opening remarks. The coronavirus pandemic, as you know, has laid bare many of them. What are the top changes your party will make to improve the lives and care of seniors in BC if you're elected? And what is your party's view of a comprehensive senior strategy for this province? And I'm going to ask that first question to Ms. Holthouse. You have 90 seconds to reply.
Okay, thank you for the question. The BC Greens believe that we need to look at the issue of senior care comprehensively. We seek evidence-based solutions, and so we are looking to look at best practices from a range of countries on how we treat our seniors and how we develop the best care we can for seniors. A comprehensive approach to us looks at not only providing good long-term care, but looking at seniors' healthcare issues, mental health issues, addresses questions of social isolation, but also looking at the affordability crisis that confronts seniors. So seniors who rent, seniors who might be living in co-housing situations. Our platform responds to each of those areas. And we need to look at how we can best globally provide good seniors care for those living in the province.
Thank you very much. Ms. Kang, you're next. You have 90 minutes to reply. What is your party's view of a comprehensive senior strategy for BC?
Definitely. 90 minutes will be a bit too long, but I'll keep it to 90 seconds.
I'll say 90 minutes, 90 seconds, thank you.
Yes. So first of all, I do like to offer my most sincere condolences to those who have lost loved ones during the COVID-19 pandemic. We know that one of the main reasons why there were outbreaks in long-term care homes across the country was because there weren't enough healthcare workers, and they weren't being paid enough to make ends meet. So they had to work at multiple homes and inadvertently contributing to the spread of the virus. So BC&DP, we immediately brought in wage increases so that the healthcare workers on the front lines didn't have to worry about putting food on the table and on taking care of vulnerable seniors, so they wouldn't contribute to the spread of COVID-19. We're committed to continuing these enhanced wages to protect healthcare workers who are keeping us safe, as well as hiring 7,000 new healthcare workers for long-term care homes. And I know that hiring these additional workers will ensure that the quality of the long-term care homes is even better than it was. And in order to ensure that our private long-term care homes are accountable to the residents who live there and the public, we're improving the standards of private care homes, and we'll also be providing free flu vaccines to every senior, long-term care, and assisted living this fall.
Thank you very much, Ms. Kang. And Ms. Pollock, same question to you. What are the top changes your party will make to improve the lives and care of seniors in BC if you're elected?
Great. And I'll be shorter than 90 seconds. I apologize for the last overrun. I didn't have the chat thing up properly on my screen, so I didn't see it. I apologize.
No problem.
I've already spoken about the $7,000 credit for home supports like the Quebec model, and the $1 billion immediate investment to replace and upgrade in long-term and assisted living residences. But we also need to recognize that we have to maintain the mix. Seniors should be able to have choice. So there needs to be public, there needs to be not-for-profit, co-op, but there also needs to be private facilities as well. We need to have that mix. We also need to look at the way that we are conducting assessments for seniors in terms of services that they are provided. That's really important. With my dad, with other seniors, much of that recently has been changed to a very hard criteria approach insofar as how many hours of home support you're getting, rather than what it used to be, which was a holistic assessment, asking what does the senior need? So those are the kinds of changes we need. And in terms of hiring, yes, we need to hire, but we need to train. And that's not going to happen by just putting people on the job. We have to train them ahead of that.
Thank you very much, Ms. Pollock. The next question actually is an extension of this issue of long-term care. It's clearly one of the most tragic issues that the COVID-19 pandemic has highlighted in BC and across the country. So I want to ask each of you to be quite specific, please, about what is your party's policy on reform of long-term care? So when we look into the future, what will it look like if your party is elected? And again, Ms. Kang, you have 90 seconds, not 90 minutes to respond. You will be first.
Thank you. Yeah, so seniors build this province and they do deserve respect and dignity, and long-term care has been long since neglected under many years of underfunding. And so what we're looking forward to is making sure that long-term care does have the staff and facility, the equipment that they need to make sure that they seniors are able to receive the care that they need. I have talked to many seniors and care providers in various regions, and I would like to recognize that long-term care providers are working their utmost best with the resources that they are given and what they have. What our party will do is we will be hiring 7,000 new healthcare workers to make sure that we make positive changes. We'll also be providing options for seniors to choose to retire at home, or whether they choose to go into long-term care, but as well giving community resources for there. So we will be setting new targets to 3.36 care hours for seniors, and we'll continue to do this work and commit additional fundings to making sure that public long-term care facilities are properly maintained, their standards are met, and that all seniors and their voices and their families are heard. Thank you.
Thank you very much, Ms. Kang. And Ms. Pollock, you're next. What would your vision be?
Oh, sorry.
For long-term care, your vision.
So thank you. Well, I think the very first thing we have to do is recognize that for the vast majority of seniors, this is going to be a transition. It's not like you flip a switch and suddenly, oh, I'm in long-term care. There's a whole transition that takes place. And one of the things that I think is a big struggle, I know it's a big struggle for seniors, is navigating their way through. The transition points for seniors who have been receiving support at home, and then gradually their circumstances change, their abilities change, their support needs change. We tend still to bureaucratically treat that as though it's a one point in time, and it's not. So we need government policy to ensure that those transition points are much simpler to navigate, and there's much greater flexibility so that individual seniors can have their needs met rather than a cookie cutter model that demands that they fit into a certain criteria. I've spoken before about the need for the replacements and upgrades. That's really important because in line with increased staffing, often what is contributing to the challenges of infection control, et cetera, in facilities is the very structure of the buildings themselves. So that's going to be absolutely critical.
Thank you very much. Let's dive in a little bit more to some of the specific aspects now of.
Oh, did we missed Anamika?
Oh, Anamika, my apologies. Please, your turn.
I just thought I'd interject there just to say that in terms of our long-term care policy, we also agree that we need to take a comprehensive approach in terms of looking at the various stages and transitions. We need to look at in place. We need to look at investing in our buildings and our people. And for us, the focus also has to be not only on the workers that are right here now, but the workers that of the future. So we need to be looking at expanding educational opportunities for workers, for foreign trained workers, and also looking at opportunities to engage people in as managers and others within the sector for the future.
Thank you very much, and my apologies again. So as I was saying, let's dive into a specific aspect of long-term care. You're all aware, I'm sure, that the Seniors Advocate has produced a report that exposes many of the inequities in funding in long-term care homes. The lack of transparency in how the $1.3 billion of taxpayer money is spent in this sector, the discrepancies between for-profit and not-for-profit care homes in terms of the number of hours spent in actual care, and the big gap between the profits made by private versus public homes. Many seniors organizations feel that long-term care should be part of the fabric of our healthcare system rather than a commodity to be privatized. I'd like to know what your party's platform is regarding funding for-profit versus non-profit long-term care homes. And let's give that question, first of all, to Ms. Holthouse. Okay. You have 90 minutes.
Again, the BC Greens have been fairly clear that in our view, we should be focusing on the standards and the levels of care for seniors rather than focusing on profit for shareholders. So right now, our public money supports people in care homes, whether they're run by health authorities, not-for-profit organizations, or private companies. And we are looking to start the shift towards a different mix of seniors care, so that the focus is more on healthcare, providers that are not-for-profits, co-ops, and not the private companies. In terms of accountability, we think that it's important to increase accountability and transparency for the care that is being delivered. And we would institute annual inspections and require financial statements and audited expense reports for all facilities, but particularly for private facilities. And I think that we need to aim high to provide as much care and excellent care as we can for seniors, care that allows them to be connected to their families and to their communities.
Thank you very much, Ms. Holthouse. Ms. Pollock, what is, you don't have 90 minutes, you have 90 seconds to answer about your party's platform regarding funding for profit versus nonprofit long-term care homes.
Sure. So
we talked a little bit about it earlier, just give us a little bit more depth about that.
Sure. So my view and my party's view is that there is no difference between seniors, whether they choose to be in a not-for-profit, co-op, public type setting or a private setting. What's important is that they're receiving the services that they want, the services that they choose, and that no senior is denied those services because of their income. I do believe what should happen is that the funding for seniors should follow them. So that doesn't mean that you pay the whole shot because somebody publicly, because somebody wants to be in a more expensive place, but you give them choice in this regard. And my dad's a perfect example. He is a low-income senior. He lives on his veteran's pension. And when he qualifies for the assisted living, that will simply give him the same support that he would receive should he be in the public side. They don't get extra. And then he will be responsible to pay with the rest of his pension any additional money that's required. I think that's fair, gives everybody choice, and doesn't remove that choice just because you don't have the money for it.
Thank you very much. Can you talk a little bit though about the discrepancies? The question is about the discrepancies between private and public homes. You're talking about a mix. How are you going to deal with those discrepancies?
Well, whenever audits find problems, those problems should be fixed. That's one of the reasons we instituted the audits in the first place, and it's one of the reasons that we insist that all of that data be made public so that those things should be addressed. But there's no magic to the idea that somehow because something's for profit, it therefore is going to be bad, or because it's a not-for-profit, it's therefore going to be good. You have to deal with each individual circumstance.
Thank you very much. And Ms. Kang, what is your party's platform regarding funding for profit versus nonprofit long-term care homes?
Thank you. And I very much agree with both previous speakers that there are great facilities all around British Columbia, whether it's public or private. And in my role as parliamentary secretary, I have visited various different models of senior care homes, whether it was not-for-profit, religious, private, or public. And what we need to do is we need to make sure that all facilities are held to standard and they are accountable to our seniors. And we are entrusting our seniors when we put our seniors into these facilities. We are thinking, okay, well, this is what you're telling us that you're going to be providing, and hopefully that this is what they will be doing and carrying through. So I really want to agree with both previous speakers in this. It's private and for-profit is not a bad thing, but what our government is going to be focused on is putting investments in public senior care homes, and as well to be investing in high-quality care providers, giving care providers better deals to make sure that they have that education needed, that they get to retrain themselves in professional development, but really looking at what seniors need. And one of the conversations that I'll end with right now is that we are looking forward to culturally sensitive care in all facilities.
Thank you very much, Ms. Kang. Now, I'm just wondering whether Ms. Holthouse wants to respond to what the two of you have said. You seem to both agree that a mix is a good thing, but the Greens are saying that they would like to move more into the area of public and nonprofit care homes. Would you like to respond, Ms. Holthouse?
I think the BC Greens are looking to add a system that will provide adequate and even excellent care. We have said the platform indicates that we are going to move towards a shift from private to a mix of publicly funded, whether that's delivered through a nonprofit or other forms of service delivery. But I don't think that that shift is going to be immediate. There were concerns from service providers that but that's not possible. Yet, as we look to developing future long-term care homes and other ways of delivering the service, we are going to be looking towards the publicly funded system. But as the point has been made, it's publicly funded, but delivered by a variety of means.
Thank you very much. I'd like to ask some specific questions now to each of you. So to Ms. Pollock, Premier John Horgan says he's going to add 7,000 new workers to long-term care. We heard Ms. Kang just mention that as well, and assisted living facilities. And he blames the Liberals for a policy which saw 10,000 care aides laid off in BC following the 2001 election. He's claiming that this left many of the homes in a dire staffing situation when the pandemic hit. How will your party remedy the major problems of staffing in long-term care? You have 30 seconds to respond, please.
First of all, his statement is statistically incorrect because over the years since the transition, all that staffing has changed. And the shortages are not anything to do with decisions made 20 years ago. The shortages are because we don't have people going into those fields. So we need to create attractive avenues for people to train. We can't just hire 7,000 people and train them on the job. And that is one of the suggestions right now, not good. And we also need to, again, look at the campuses of care too. Often there are means by which changing the campuses can actually make the performance of the duties more efficient. But there's no magic bullet for any government. It's going to be hard to find those workers and attract them into that field.
Ms. Kung, would you like to respond to that, to the 7,000 workers?
Yes, I would also like to really point out that it is, I support the comment of my premier, and when I came into this role, I found that our seniors were at risk, and we need to really up our game and our investment in senior care and to keep them healthy and safe. And so one of the things that came out of COVID-19 that we saw was the lack of care providers being able to work at one facility and having that training. So what we are doing is we are fixing the understaffing problems. We are fixing the contract flipping problems. We already have hired 2,000 new care workers in long-term care homes, and we're going to be adding on to that the 7,000. What we will be doing, sorry, was it 30 seconds?
Yes, it was 30
okay,
seconds.
yes.
And I do want to ask you another question, Ms. Kang. The NDP has expressed an interest in moving from private to public long-term care homes eventually, as you just said. And yet we've learned that 80% of the new publicly funded beds in care homes in the Interior Health Authority, particularly in the Okanagan, have gone to the private sector. So how do you account for that?
Well, we know that seniors will be living where seniors are living, and they will be retiring where they choose to retire. So one of the things that our government has done is to change the first bed policy, is that seniors will be able to choose where they want to retire and where they will be able to choose the facility that they hope to. Because many people previously they were retiring and put in a facility that had an open bed, and what this created was that families had to travel long distances to visit their loved ones a long way off. So these facilities are some facilities are new, so they're built and there's beds to them, and the process of applying for these beds are the same in private care and public care. So I'm hoping that all these will be upholding their standards to providing good care for seniors.
Thank you very much. Ms. Holthouse, Premier Horgan also says that he'll maintain the pay increases that were instituted for long-term care workers at the beginning of the pandemic to bring all care aides up to a standard wage. And this means that government funds are being used to subsidize lower wages in the long-term care sector, which may also have the effect of helping for-profit providers to maintain high profits. So I'd like to know what your party's position is on wages for care aides and this particular dichotomy.
Well,
30 seconds, please.
thanks for the question. Clearly, the COVID crisis showed us that we need to address the wages and working conditions for caregivers and other health professionals in the sector. We need to ensure that caregivers are getting living wages. That is a basic part of our platform. We also are committing to establish a permanent Fair Wages Commission, which would recommend predictable increases to the minimum wage. As I mentioned earlier, though, wages are part of the problem. We also have to ensure that our colleges and universities and technical institutions have the educational opportunities for health professionals to be able to graduate. And we have to make sure that we're removing barriers to education that might exist for a number of different doctors and foreign trained and other professionals. And also, I think it's important that we, the BC Greens, are committing to providing childcare for working families with children under 3. So we need to look at a whole range of factors that support the workers in the senior sector.
Thank you very much, Ms. Holthouse. Just one more question that relates to long-term care, and I'd like each of you to answer, and you have 90 seconds to answer. So what will your party do to work with the federal government to develop appropriate standards of care? We've already raised the issue of standards of care, which desperately need to be looked at, as described in the most recent throne speech. And what methods will you use to enforce those standards in long-term care? And I'd like to ask Ms. Kang to be the first one to answer that question.
Thank you. So during my time as parliamentary secretary, I was able to meet with all the provincial ministers and territorial ministers in charge of senior care. And so we met with the federal minister, and I would encourage whoever holds the next position to continue this very valuable conversation. I have heard that the Prime Minister has committed to making sure that he improves Canada's healthcare system, and this does include senior care. He talked about improving access to family doctors, which very much seniors will need, and prescription drugs, which I am hearing that we need more fair pharmacare, more affordable drugs. So I'll be working to hold the federal government accountable to their promises and investments. I've also know that the federal government is working towards the next critical steps towards national pharmacare program, and that when he said that implementing such a program would include negotiating and discussing this plan with provinces to improve healthcare outcomes, I am committed to making sure that he has that conversation with our government and that BC gets their fair share of funding so that we can address affordability of prescription drugs for seniors.
Okay, thank you very much, Ms. Kang. We were actually talking about standards of care, and I guess pharmacare is one of those issues, but
yes.
I'm going to get into medication, and pharmacare a little bit later, I hope. It's a very important issue, thank you. And so I'd also then like to ask Ms. Pollock what your party is going to do to work with the federal government to develop appropriate standards of care and methods to enforce those standards.
Great, thank you. I've had lots of experience with Fed provincial negotiations, and there's a similar cast to all of them, regardless of the topic. Fair share, as Anne has mentioned, it's always something British Columbia has to fight for, especially with the large number of seniors we have per capita. But when it comes to standards, British Columbia has been faced with that in a number of fronts. Environment's one, there's a whole range of them. And our experience has been that it is important to make sure that the federal standard becomes your baseline. Otherwise, if you simply give in to a federal standard where the province has no ability to add, to alter, you can end up in a situation that doesn't reflect British Columbians' needs. So negotiate a baseline standard that would be across the country, but leave us with the ability to go beyond those standards and require them, have the authority to require them. As far as accountability, again, we have an audit system that can certainly be increased in terms of its frequency and its specificity around the requirements and standards. And anything we can do as a government to open up greater transparency with respect to those audits is something we always should do. That's the only way to truly hold these folks accountable, is if everything is out in the open for anyone to look at.
Thank you very much, Ms. Pollock. And the same question to you, Ms. Holthouse. How are you going to work? How will your party work with the federal government to develop appropriate standards and the methods to enforce them?
Well, I think that we're probably all pretty well in agreement in terms of the need to keep talking with the federal government and the various federal, provincial, territorial working groups on these issues. I think Mary's point of needing a fair share and needing flexibility to go beyond a minimum baseline is an important point. I also think that we need to be looking at making sure that the areas of care that are addressed are things that are also addressing issues of concern to British Columbians. So one of the areas that I just wanted to highlight was the whole need for the cultural competency training for existing caregivers and future caregivers of both healthcare practitioners, but also seniors providers. So ensuring that there's that Indigenous lens on these types of issues is important when we're developing a national standard. So,
and enforcement?
Well, in terms of enforcement, I think there's that's going to be different for each province in terms of what their type of enforcement, but clearly, as the BC Greens platform indicates, we're in favor of maintaining good standards of accountability, transparency in how that is done. And then we'd have to look and discuss with the federal government what the levers of enforcement or accountability would be. And that, I think, is for the future discussions.
Thank you very much. Soon, we're going to be looking to our audience members for the questions that you'd like to have the candidates answer today. So please, another reminder to send your questions via the Q&A panel at the bottom of Zoom. And if you see that someone has submitted a question that you would like to have asked, remember to vote for that question by clicking the thumbs up icon. All right, a question to all of you now, and a very important question. When asked, and where possible, most seniors would prefer to age healthily at home for as long as possible. What will your party do to ensure that it can happen? So Ms. Holthouse, let me ask you to respond to that question first, and you have 90 seconds. Home care.
So I think that what the COVID crisis has shown us is that many seniors would prefer to age in place. They would are concerned about making sure that we are in resilient and livable communities as they age. We need to continue to invest in our primary care networks. We need to, as Anne has mentioned before, we need to develop an essential drug program so that we reduce drug costs. Mental health and social isolation for seniors are big issues, and so that the BC Greens are hoping will be part of the medical services plan. And I think we need to have a broader discussion about how people age in place and how we reduce social isolation and how we maintain the contacts between seniors and their families, seniors and young people. So there are various models for more sort of intergenerational contacts. But those are areas that we would need to explore and that the BC Greens think are important to consider.
Ms. Kang, your time, you've got 90 seconds to answer that question about home care and your party's position.
Thank you. And I've had the pleasure of really working with many seniors in my community. That was one of my passions because it's something that I really value. Coming from background of family who are volunteers in the community. The BCNDP will be in our platform, is creating a new hospital at home program in order to not only ensure that seniors can remain at home and get the health attention and care that they need, but also limit the spread of COVID-19. As we know, this has become a terrible new normal. This program also means that there will be fewer trips to hospitals and more time in their communities. And for people who, like my mom, is caring for my grandfather, for parents, for elderlies, this means that they get to be able to stay home, but adult children get more respite to recharge. I also previously did announce a $255 million funding towards improving home care and home support. And we also had a federal dollar funding in our first year in making sure that we are able to do that to the fullest possible. We'll continue to expand publicly funded home care to provide better care for seniors and to provide help with daily living like bathing, dressing, meal preparation, and more, so that seniors can stay in their homes for as long as possible. So this will improve continuity of care for seniors, receiving visits from a more consistent group of care aides and keeping them safe at home.
Thank you very much, Ms. Kang. And Ms. Pollock, your answer to that question about how your party is going to ensure that home care can happen and people can live healthfully at home. You have 90 seconds.
Thank you. And of course, this is also one of the things that governments are going to have to take very seriously if we're going to deal with the statistical reality of an increasing size of our seniors population. We have to emphasize staying at home. So, couple of things. One, the Better at Home program, which we launched, that certainly could use expansion. You need to make sure that services are transportable. And that means that while you have very good home health services around the province in every community, there are models in place that I think do a better job and we could learn from. One of them is the Veterans Independence Program that's run by DVA federally. And it takes the view that it provides all sorts of funding for things that we mirrored in some ways in Better at Home, but all sorts of things that aren't necessarily health related, because a senior's needs to stay at home are not just about their health, right? It can be little things that they need done around the home to make it possible for them to live there. So you have to expand the idea of what you're funding and supporting beyond just the health supports. It has to be a realistic view of what it takes for a senior to live in their own home.
Thank you very much, Ms. Pollock. And I'm glad that you raised the issue of the Better at Home program, because I'd like to ask a question that was asked by Constance Cameron, who is in our audience. And she says, due to coronavirus, seniors are increasingly uncomfortable moving into care homes. They want to age in place at home. Although there is Better at Home in BC, the cost of these services over time can eat up many seniors' savings. How will your party make it more affordable for seniors to age at home? Ms. Pollock, do you want to continue? Go ahead.
Just to say, I'll expand on my previous answer. Our definition of what health means for a senior to live at home in a healthy way has to expand beyond just the rigid view of something that's health or not health. If we do that, if we start to incorporate services such as many of the ones you see in Better at Home into what we think of as health, then that would solve that issue in a big way. And although that costs government money up front to support those services, it saves a tremendous amount on the back end with healthier seniors, with a greater utilization of space for those seniors that must be in long-term care or assisted living, because you're using then the capital that's out there in their own home.
Thank you. Ms. Cohn, do you want to respond to Constance Cameron's question? How will your party make it more affordable for seniors to age at home?
In my opinion, it definitely is more affordable for seniors to age at home for so many reasons. One is that seniors are connected with their community. They are able to have support from nonprofit organizations that they know and are familiar with. And when seniors are not isolated, they are socializing with their friends. They continue to remain in a better state of health when they are put into care homes or long-term care homes where everyone else is more isolated isolated or roomed in different ways. Our party, we will be investing $1.6 billion in preparedness plan for within this COVID-19 time to make sure that we do deliver that 7,000 new frontline health workers in long-term care homes. But as well, we are investing and hiring new healthcare workers with a $44 million investment to make sure that healthcare workers are able to be providing services to those at home as well. But something that we have begun in our term is we are investing in team-based care. And what this means is that teams of doctors and nurses and practitioners and other healthcare workers will be able to take care of the senior within their community. And this is really important, is to be able to have a holistic approach of who the senior is, what their need is. Keeping seniors at home definitely is a very cost-saving but beneficial lifestyle that seniors are talking about.
Thank you very much. And Ms. Holthouse, your response to this question about making it more affordable for seniors to age at home.
Well, the affordability piece is one aspect, I think, of a comprehensive approach to keeping seniors at home and allowing them to the flexibility to age in place. So there's investments in transit and resilient and livable communities are all aspects of this. We also have announced a rental supplement that would close the gap for affordable rent and what renters are actually paying. That will help some seniors that are currently renting. We are looking to invest in supportive and social housing through co-ops and other things, which again helps those seniors who are downsizing to perhaps co-housing. And then we have to look at other aspects of seniors who are living in stratas and dealing with strata insurance rate increases. So there's a whole host of pieces to being able to stay in your home and age in place. And then some of the other things my colleagues have talked about in terms of home care supports and services that are available to seniors to deal with, housing, household issues and errands and all that.
Right, thank you very much. None of you have really mentioned the issue of family and friend caregivers who are so essential to seniors living at home healthily, but the financial, particularly the financial burden, the stress, the mental health burdens are enormous. Very, very briefly, 30 seconds, what would your party do if elected to assist these caregivers? Ms. Kang, 30 seconds.
Oh, yes. Yes, so we have made investments in family and friend caregivers in terms of providing respite, because we do know that it is these really precious friends and our neighbors that are taking care of our seniors, and oftentimes they will get burnt out. So we have invested in adult daycare when during COVID-19 we weren't able to operate those, but definitely we have made investments and we will continue to do that in the years to come.
Thank you very much. And Ms. Pollock?
So I've lived this, and I'll tell you the biggest thing you could do is stop arbitrarily deciding that because something isn't health related, it shouldn't be funded. The idea that you have an elderly person with early stage dementia and you can't, excuse me, you can't qualify for health funding to have someone who just is there to spend time with them when you know they might get up to something dangerous. That is something you live and breathe when they're living in your home, and it doesn't get funded because it's not health, right? It's just companionship. It's important.
Thank you. And Ms. Holthouse, caregivers, family caregivers, how can we support them? 30 seconds, thank you.
Okay, supporting caregivers is, particularly family caregivers, is really crucial. Our plan also includes $1 billion over 4 years to make mental health a part of the medical services plan. So that will assist caregivers and the seniors themselves. But then we also are looking at a loneliness strategy, which is the UK has instituted a loneliness strategy. And that's basically to try to address some of the social connection aspects and feeds into what Mary was talking about in terms of needing to look more broadly at what is health and what are the social determinants of health, because it isn't only healthcare, it includes all aspects of your personhood.
Thank you very much. Okay, a question to all of you. You will have 90 seconds here. The BC Seniors Advocate reports that the BC Seniors supplement of $49.30 a month for the lowest income seniors is one of the lowest provincial subsidies in Canada. During the pandemic, this amount was raised to $300 a month from April to December 2020. What is your party's plan for the benefit starting in January 2021? Ms. Pollock.
Well, you can't just arbitrarily cut it off and leave people in the lurch when the pandemic is keeping on going. What you could do, though, if there's a transition that needs to be made, if the pandemic is going on longer than we anticipate, we have to start looking at other ways that we can support as well. So, for example, there are some targeted ways that you can increase the affordability for everyone who needs it. The SAFER grant, for example, could certainly be expanded. Shelter aid for elderly renters that tops up their rent payment without having to be an overarching service. So it's means tested, right? There are targeted programs like that that I think you could look at. Whether or not you should continue the straight up $300, I think that's a matter of how long the pandemic goes on, and do you shift those resources into programs that are going to target where you've seen the most need, and SAFER is one of those examples.
So you're not absolutely certain whether you'd like to see that continue, pandemic or no pandemic?
Yeah, I'll be clear. It's not a question of whether it should continue or not. It's should it continue indefinitely, right? And what I'm saying is December 2020, which is coming quickly, is not the time you just cut everybody off. How long should it go? I don't think anybody can say that until we know how long the pandemic's going to continue, because they're going to continue to have those needs.
Thank you. Ms. Holdhouse, what's your party's plan for that benefit starting in January 2021?
Well, I think we will need to look at the benefit in the context of other services and benefits that are being provided to seniors. It's hard to say one benefit in particular at that time, but we will obviously need to provide for seniors in COVID times. And I agree that I don't think we're going to be out of the woods yet for a while. So the BC Greens are looking at a basic income task force and looking at what we can do with implementing a basic income. That will be a factor in terms of looking at all of our benefits and how do we provide minimum levels for people to have decent, livable, if not wages, at least incomes. Then and the seniors will be part of that. So in terms of talking about one benefit or not, I think we have to look at it globally.
Thank you, Ms. Kong. The
benefit. Yes, and I am very proud of the way that the BC NDP has acted in swift action and taking care of our most vulnerable population. And approximately 58,000 low-income seniors have been benefiting from the 300 monthly crisis supplement without impacting what Mary has said, the federal benefits or eligibility for the SAFER. BC is a very expensive place to live. I have to admit that. You know, I'm a single mom in a big city, and I have heard the exact same stories from the seniors who have come to my constituency office is how they're struggling to make ends meet, and they have to choose between medication and groceries. So what we want to be doing is finding ways to put money back into seniors' pockets by, for example, what we could be looking at is to eliminate the requirements for people age 60 to 65 who are receiving income or disability assistance to apply for early CPP at the age of 60. You know, because this will result in more than 35% reduction in a lifetime benefit. But very similarly to both previous speakers, we recognize that right now we are in the middle of a pandemic, and come December 2020, we will revisit the situation and ensure that our actions fit the needs of our senior population.
Thank you very much, Ms. Kong. And thanks all of you. Oh, Mary, you wanted to say something quickly?
Just thought it was important to note there is agreement between the three of us about this. And the reason is because that is one of the initiatives that all three parties in the legislature gathered together on and unanimously supported to fund. That was part of the $5 billion that all three parties did together.
Thank you very much. I guess the important thing is where will it go in the future, and will it be maintained? So I want to thank all of you, all the candidates, for your responses to these questions. And now I think we're ready to move on to questions from our audience, those questions that have come into our Q&A box. And so the first question is from William Engelson, and he'd like to review some of the commitments on healthcare staffing. William notes there are other options to long-term care, such as we discussed, keeping seniors in their own homes with necessary supports, especially home support workers. How will you ensure those workers will include home support workers? How about Ms. Holthouse? Can you answer that question to begin?
Well, I think we have to look at the whole range of workers that are in providing care, whether that's in homes or in long-term care situations. I don't think we are going to be saying one sector is more important than another sector, but we do have to make sure that we are providing livable wages for those workers, and as we've talked about, opportunities to see these jobs as real professional careers for them. So I think we have to look at them, all of the workers, and not just one or the other.
Thank you very much. Ms. Cohn.
It is very important to make sure that we maintain our home care workers. Sorry, I got a little distracted there. Can you repeat the question for me again?
The question is that William Engelson would like to review some of the commitments on healthcare staffing, and he talked about other options to long-term care, such as home care, and he wants to know how would your party ensure that those workers in homes, especially home support workers, will include home support workers.
Definitely. So one of the things that I was working on is to make sure that seniors do have that choice to choose between staying at home and retiring at home, and being able to choose between that and long-term care homes. So definitely the funding will be there. We are training up new senior care workers to make sure that our growing population, senior population is cared for. As we all know, the statistics right now in British Columbia, that there are 20% of seniors who are 65 years and over. And in the years and days to come, in about 20 years, we will have 25% of our population being seniors. And we have discussed today already that it is beneficial to everyone, families, seniors, but also government. It saves money to keep seniors at home. So definitely this is a direction we will be going, and we will be building a new healthcare medical a medical university to make sure that we train up more people so that these support services are there for seniors wherever they choose to retire.
Thank you very much. Now, Ms. Kung, you had earlier talked about pharmacare and the price of pharmaceuticals. We do have a question in the Q&A panel. Pharmacare was mentioned earlier, as I just said, and we have a question from Blake. Even with fair pharmacare, too many seniors must choose between paying for groceries or paying for their prescription drugs. What concrete steps will your party take with the federal government to create a national pharmacare program that'll be universal, public, single payer, and portable? Can you answer that, please?
I have been advocating for fair pharmacare and these services with my federal counterparts, and I've heard from many seniors about this difficulty of choosing between drugs and medication and groceries, and it just really breaks my heart. We have heard these concerns, and we have eliminated or lowered pharmacare deductibles. These are concrete steps that we've taken already for a quarter million low-income British Columbians, and these a vast majority of these British Columbians do include seniors with fixed income. And not only that, but BC NDP will also be launching the Safer Seniors seniors, Stronger Community Program, which pairs volunteers with seniors living at home who need medical support. So it has already helped 15,000 individual seniors with anything from virtual visits to grocery stores to prescription pickups. So definitely I will continue to fight for a national pharmacare program while enhancing the fair pharmacare. And we will continue to review the cost thresholds of the drug eligibility with a goal of bringing the cost of prescriptions down for all seniors.
Thank you very much. And Ms. Pollock, your answer to that question, what concrete steps, maybe let's try to keep this a little bit more concrete. What will you do, what will your party do to work with the federal government to create a national pharmacare program that's universal, public, single payer, and portable?
One of the most important things you can do when you're a provincial minister and wanting to accomplish this is to work very hard to bring your other provincial counterparts on side. It's one of the things that we did in environment with respect to trying to get a national carbon pricing strategy, and we'd need to do the similar kind of thing when it comes to national pharmacare policy. When you've done that, then you have to be evaluating the formula they plan to use and advocating quite strongly that it's not based just squarely on population, but it takes into account the projected percentages of populations that are going to be seniors in those provinces, because that's where British Columbia gets shortchanged frequently. So that would be a specific ask that I would have. And we also need to encourage both the federal and provincial processes to be more responsive when it comes to getting new drugs onto the formulary. New drugs are being introduced all the time for seniors, especially with respect to dementia care. And many of them, it takes years to have them covered. Meanwhile, the senior is paying out of pocket. We need to be more responsive to new medications that come online.
Thank you very much. And Ms. Holthouse, I wonder, another aspect of this pharmacare issue is over-medication, and it's a huge issue for many, many seniors. Too many seniors are prescribed too many drugs, and over-medication and polypharmacy contribute to many health concerns, particularly falls in older adults in BC. In fact, they say we have research that 1 in 5 hospital stays are attributed to over-medication, which obviously leads to rising healthcare costs, and not to mention the human suffering that results. What will your party do to deal with this problem of over-medication in both long-term care homes and in the community? And with respect to the pharmacare question, how will you work with the federal government?
Well, I think we would agree that we need to be involved in the conversations at the federal provincial level. We need to be active there on the pharmacare issue. The BC Greens are promoting a essential drugs program as part of our platform. And we also think that we need to collect better data on the various disparities in our health system, and obviously pricing for drug costs is one of those issues. And we're suggesting to establish a task force to look at what are the needs of our population, including seniors, and what services are provided by the various healthcare providers and sectors. So looking at acute care, looking at pharmacare, looking at preventative care. If we put more money into preventative care, then we might be addressing some of these issues of over-medication. So there's a range of issues that we need to look at in terms of balancing the needs of our population and our senior population and these various healthcare questions. Our proposal is that we start to look at these and that we report, and that can feed into our federal, provincial, territorial discussions on these issues.
Thank you very much, all of you. Moving to a question from another audience member, Ian Sanderson notes that programs such as home care, independent living, and assisted living have often been run as independent programs, when what is really needed is an overall program that allows seniors to seamlessly move from one level to another. How will your party ensure that all these programs work together seamlessly, with primary health care integrated with a range of social services within the community to provide a continuum of care in age-friendly communities? Ms. Kung, can you answer that question?
This is definitely a very important topic because what we see in senior care, in many cares that we have programmed around different types of people in our province, is that they're not connected. And this is a really great issue to be talking about. So we have started something called team-based care, which would include nurse practitioners, family doctors, and so everyone would have information in terms of these the profile of the patients and the seniors that we're working with. So what I'm dedicated to do is to making sure that all these programs are connected into a network of care or a campus of care. I know a lot of our information are now being digitalized, and I'm looking forward to see how we can safely integrate these information without breaching any privacy information. But communication will be one of the key points, because when we put our seniors in care of one facility to another, whether it is the hospital or the doctor's office or the senior care home or just the care provider at home, there seems to be a disconnect of information that's flowing around. And part of that is paperwork. And paperwork seems to just fly all over the place. So hoping forward, technology will be an assistance to that, but team-based care in our community will also be assistant to that as well.
Thank you very much. And I'd like to ask that same question to Mary Pollock. Mary, how does your party see primary healthcare integrated with a range of social services within the community to provide that continuum of care for older adults?
Philosophically, we have to make the big shift away from thinking of seniors as patients. Getting older isn't a sickness. Getting older is part of life, right? When we do that, we can stop with what happens right now, which is a very arbitrary criteria around how you transition from at home to, say, assisted living. To be on the wait list for assisted living, you have to qualify for what I believe is an arbitrary criteria, which is you have to have 40 hours of personal care, period. If you don't have that, you don't get on the list. Now, there's the magic. What is considered personal care? Well, for example, having someone come and remind your loved one that it's time to take their medication, that's not considered personal care. It would in my books, but that's where we've unfortunately fit into this box of thinking if it doesn't fit our definition of healthcare, if we can't look at that person as a patient, then we don't assess them in to services they could use. Instead, we should move to what we used to have, a comprehensive assessment by a professional like an occupational therapist, or there are various others, and use their judgment, not some arbitrary criteria.
Thank you very much. And Ms. Holthouse, do you have anything to add to look at this integration of services?
Well, I think it's important, as been said by my colleagues, to look at seniors holistically and to look at the continuum of care, and not in silos. So what that often means is looking at what are the systemic barriers to things like exchanging information, but also to ministries working together, and to just making the system between the health system, the seniors care system, the coordination of services easier, and what are the barriers that we should be looking to eliminate. And that requires, we suggest, a task force, but it requires a comprehensive look at how are these services delivered and what would make, can they be best improved.
Thank you very much. It looks as if we have time for one more question from our audience. Alan Trepanier shares that wait times for medical procedures have been made even worse during the pandemic. What is your party's position on improving medical services in BC, and in particular, wait times for surgeries? Ms. Pollock, can you answer that?
Yeah, and it's the 64,000, or maybe we should say $64 billion question, right? It's across the Western world. But what can we do specifically in British Columbia? We've got to do more to train more physicians who are specializing in the areas of surgery where we have the greatest need. Orthopedic surgeries, for example, trying to meet that need in an exploding demand environment is going to take more physicians who have that skill. What we found in the past statistically is that as soon as you get through the wait list, there's so much backfill from people that have been waiting but not on a list that you never get there. So it is something that all governments across the Western world are going to be challenged with for years to come. And the only way we're going to get past that is by trying our very best to attract and to train surgeons in those specialties so that you have the people, because the ORs aren't enough. You actually need the people trained to be able to do the work.
Thank you very much, Ms. Pollock. And Ms. Holthouse, what about you? Wait times.
Well, clearly wait times were exacerbated by the exigencies of the COVID-19 crisis. I don't think any of us, expected that. Yet at the same time, I'm not sure that just, training more doctors is our solution. We also have to look at how are our services and our ORs being used? What are the best mix of services to better to address the wait times? But I think these are complicated issues that aren't, if you focus just on one aspect of the system, you need to look at the system as a whole, and we need to take those comprehensive measures because you can have unintended consequences. So those are, they're big issues, but I think they're important ones that we need to look at.
Thank you very much. Unfortunately, we're going to have to wrap things up now with very brief closing remarks from each of our candidates. Candidates, you have 1 minute, and we're going to be very, very mindful of that to provide your closing remarks. And as with our opening remarks, we have randomly selected the speaking order for those remarks. And the speaking order will have Ms. Holthouse with the Greens speaking first, followed by Ms. Pollock with the Liberal Party, and we'll conclude with Ms. Kung and the NDP. So Ms. Holthouse, over to you. You have 1 minute.
So thank you very much for this debate, my colleagues. I think that the BC Green platform addresses not only the issues for seniors, but issues for their grandchildren and their children. So we have a broad environmental platform. We have a green economic recovery platform. And then we want to address all the issues that COVID-19 exposed in terms of seniors care under previous governments. We've discussed some of the aspects of a comprehensive platform to address affordability issues for seniors, to address aging in care, to address the shift from for-profit to a mix of not-for-profit and other types of care. But I think the major issue is looking at how we treat seniors and how we see seniors, not as a commodity, but as our parents and our grandparents, and how we deal with them as human beings, and looking to provide the best care we can and the best accessible system for seniors in the province.
Thank you very much, Ms. Holthouse. And Ms. Pollock, your closing remarks, please. 1 minute.
Thank you. Thank you for the dialogue. Thank you for your questions. As you can probably tell from the remarks that I've made over the course of the afternoon, this is something really personal to me. And I think we are not going to provide the best for our seniors if we're not willing to squarely face what's ahead of us. And that is many more seniors who don't have family supports around them. Seniors who want to do the same kinds of activities they've done all their lives for longer and want to be in their homes. That means our system needs to be more flexible, far less rigid in terms of how we define health, and willing to look at a senior from the standpoint of their personhood, not just the fact that they are a senior in need of some care. Because guess what? We all need care at some points, and aging in place shouldn't be considered something that makes you a patient.
Thank you very much. And we'll conclude with Ms. Kung with the NDP for your closing remarks, please, Anne.
Well, thank you so much to everyone who has extended this invitation to all of my colleagues here. I've really had a wonderful time listening and getting in touch with seniors and seniors issues. I know that there are a lot of issues that we have dealt with, and we have tried our best to fund, and it has been only 3.5 years, and I am very, very committed to continue to doing this good work, because seniors deserve it. It is seniors, it is my parents, my grandparents who have brought me to Canada and gave me the life that is here, so I cherish that. I remembered my teachers, all my mentors, and eventually all of us will need to have a dignified way of retiring, and this is what we really seek to do. In terms of answering how we're going to be reducing wait time, it is very important because seniors are telling me, I have no time to wait. I can't wait for another 5 years for the hospital to be built. So immediately we're going to be investing billions and billions of dollars in hospital care. And we're developing new strategies to optimize surgical and diagnostic space teams. I'm just looking at the time. And we are adding 4 more MRI machines so that we will be able to handle more patient care for everyone. So our commitment is there and our sincerity is there. So thank you so much for joining us for this long afternoon.
Thank you, Ms. Kang. And that's all the time that we have for today. We have covered a wide range of issues. I want to thank all the candidates for participating, and particularly a big thank you to the audience for your interest and for all of your insightful questions. I'm now going to invite Sheila Pither on behalf of COSCO BC and Leslie Gaudette for the National Association of Federal Retirees to make their closing remarks. So Sheila, over to you.
Sheila, you'll need to unmute.
Leslie, would you like to make your remarks?
No, I'll let Sheila go first. Yeah.
Okay.
Sorry. Sheila,
Okay.
there you are.
There you are. Great, Sheila.
I have a horrible habit of doing that. I want to tell you about the COSCO motto. It's plan with seniors, not for them. I also like nothing about me without me. And thank you very much for a wonderful time. And Joyce, thank you.
Thank you, Sheila. And over to you now, Leslie, for your closing comments.
So I'd just like to thank all the candidates for taking the time, especially at last minute, to speak with us today. And I thank our moderator, and I thank all who have joined us today. It's been a wonderful journey through a number of issues related to seniors. Be sure to check your email for a recording of this virtual town hall and our website at www.federalretirees.ca for more information. We also have information up on the COSCO BC website as well. So there you'll find more information about the BC election, including key priorities and a letter to the editor template you can use to help make older adult care a priority in this election. We know that many of you had questions that we just couldn't get to in the time we had, and that's why we hope that you'll each take the time to connect with your local candidates. And there's wonderful information up on all the party platforms and websites that will allow you to explore their platforms in more detail. You can also find the contact information for the candidates on their websites, and you can look at Elections BC to get a list of all the candidates in your riding, some of whom would be from parties that were not present today. So I'll end with the words of one of our leading public health officials, and having come from the Public Health Agency, I am so happy that I can now repeat the words of Dr. Bonnie Henry. And I encourage all of you to be kind, be calm, take care of each other, and stay safe. Enjoy the rest of your day, and thanks to all. Bye.
Thank you. Bye-bye.